It has now been 4 days since the deadly quake in Haiti. Emergency rescue workers facing dire conditions as they race to avoid a second catastrophe, an epidemic spread of disease. There is a lack of drinkable water, few working medical facilities, the roads mainly impassable, and a growing number of unburied dead in the streets. All factors compounding this tragedy. Just hours ago, our own Dr. Jennifer Ashton landed in Port-au-Prince, Haiti. She hit the ground running, immediately assisting in an amputation of the UN hospital compound, which is on the far east side of the airport. She's joining us live now this morning from Port-au-Prince with the latest on the medical relief effort. And as we said, you really had to jump right in as soon as you got there, Jennifer.
Yeah, absolutely, Erica. We arrived last night with a team of 11 other doctors and nurses, part of a mission from the University of Miami School of Medicine. The MASH unit, or mobile hospital unit, that I am working at has about 200 patients, has about 60 doctors and nurses comprised of everything from internists to trauma surgeons, orthopedic surgeons, OBGYNs, pediatric nurses. About 50% of the patients at this hospital unit are women, 30% are children, most of whom have severe fractures, in many cases what we call open or compound fractures, and they're in bad shape. I will share with you a patient story of a girl we took care of last night. Before you watch the video, Erica and viewers at home, I should warn you, we're not sure how it's edited and the images are quite graphic. This was a 15-year-old girl named Lovely who was brought in after being extricated from rubble. She was trapped under that rubble for 3 days, and as we know, as the days go on and on, it becomes less likely to pull out survivors. She actually had a dead body on top of her, and a search and rescue mission from South Florida actually amputated her arm above the elbow. When she was brought into us, she was obviously in shock. She was in critical condition, and we spent a greater part of the late morning hours taking care of her. If you can see on the tape, Erica, the surgery that we performed on her to stop the bleeding of her arm after the amputation was performed was done on a folding card table under trees. To say it's primitive is an understatement. This is analogous to Civil War medicine. This is just amazing. And we do want to point out, too, that you are there in the capacity of there as a working doctor. You went there to help the people there, to do what you can as a physician. Tell us, on day 4 now, you told us earlier in the week the first 72 hours were the most critical with this disaster. We are past that point. Day 4, what is the situation like? What is your greatest concern? What we're seeing in the MASH unit, the mobile hospital that I'm at, Erica, is a lot of dehydration. Infection is starting to set in. We do have some scarce medical supplies, things like IV fluids, antibiotics, but most of these patients have not eaten in 3 days. They are profoundly dehydrated, and they have crush injuries to their long limbs, upper arms, body, in some cases open pelvic fractures, which set the scene for some very serious and life-threatening infection. In addition, when limbs get crushed like that, if they don't have surgical management immediately, they risk losing that limb as the swelling and infection really takes off. And that's what we're seeing overnight. In the middle of the night, we worked all through the night, and we're seeing more of that this morning. So what is your greatest need medically then at this point? Is it something as simple as water? We are getting water, and we are gradually getting shipments of medical supplies from the United States as these planes land several times during the day. They are coming in about every 3 or 4 hours from the University of Miami system to our mobile hospital. But at this point, estimates are that there are less than 1,000 medical personnel on the ground here, including doctors, nurses, paramedics, people trained in trauma and war casualties. That is not enough. There are places where they have 2,000 patients and literally, 5 or less doctors and nurses. So the need for those medical personnel is extreme. We are happy for the people on the ground there that you are able to be there to help out. But as you mentioned, so many more are needed. Dr. Jennifer Ashton, Jen, thanks for being with us this morning.